Welcome to Health Source of Prescott, Arizona. Today's topic, decompression therapy and effective back pain relief. Decompression therapy to help that aching back. Non-surgical spinal decompression therapy is a procedure for treating chronic back pain. If you suffer from back pain on a regular basis, are limited in your daily activities, or have had surgery suggested as the best way to treat your pain, then decompression therapy may be a treatment worth investigating. How it works. The primary focus of non-surgical spinal decompression therapy is to treat disc injuries in the lumbar and cervical regions of the back. Distraction forces applied to the spine gently separate the vertebrae. This in turn creates a vacuum inside the disc, pulling the edges of the bulging disc back towards its center and relieving the pressure placed on nerve roots by the disc. The periods of distraction alternate with periods of rest. This pattern over time and a series of visits gradually restores the normal fluid and nutritional balance to the disc and returns it to its normal or near normal state. This restoration keeps the disc flexible and alleviates any brittleness that may have evolved. Treatment involves lying on a comfortable, specially built table which flexes and bends in different directions under rigidly controlled conditions. Patients find the treatment not only effective but pleasant as well. Who it will help. Non-surgical spinal decompression has had its greatest success treating patients suffering from pinched nerves, sciatica, radiating arm pain, degenerative disc disease, and herniated and/or bulging discs. Before making any decision, the patient's overall health and history is carefully examined to provide a proper diagnosis. The healthcare professional may recommend X-rays to eliminate bone damage, magnetic resonance imaging, MRI, or ultrasound or any combination of them to ensure that a correct diagnosis is delivered. Other treatments. Although non-surgical spinal decompression is growing in favor and is preferred over many other types of treatment, it's not the only effective therapy available. Some other treatment methods include traction. Traction has long been the standard treatment procedure for treating disc-related ailments. This method involves applying upward force to the length of the spine, most typically at the skull, pulling the spine in opposite directions while the body proper remains in place. It is commonly used for treating injuries to the cervical region to manage spinal instability in this area or for realigning cervical dislocation. Surgery. The reason for the repetitive use of the term non-surgical spinal decompression is that there is also a surgical spinal decompression. This procedure is considered a last resort for treating spinal column and disc problems. Its effectiveness varies from situation to situation. It is an effective treatment, but it is accompanied by the same problems as any invasive treatment. These problems include adverse reactions to anesthesia, long recovery periods, including an extended period of bed rest, followed by rehabilitation and physical therapy. If you have been experiencing back pain attributed to disc problems, non-surgical spinal decompression may be a solution to your problems. Consultation with a qualified healthcare professional will provide you complete information on all aspects of the treatment procedure. To find out more information on topics like this, please go to www.healthsourceofprescott.com.